Roll call, adoptive family, Jessica Pagan.
Present online.
Thank you. Best Foot Forward, Debbie Ellman.
Present online.
Thank you. Black Chamber of Commerce, Palm Beach County, Cassandra Oliver. Card at FAU, Jack Scott.
Aye, I'm present.
Thank you. Card at FAU, Sabrina DeGoges.
No.
Coalition for Black Student Achievement, Dr. Deborah Robinson. Coalition for Black Student Achievement, Deborah Stewart. Compass, Amanda Canetti. Compass, Rex Barnes. Connect to Greatness, Dr. Cassandra Corbin Thaddeus. Connect to Greatness, Andre Thaddeus.
Present online.
District ESE Advisory Committee, Kimberly Spire O. Okay. District ESE Advisory Committee, Michelle Beatty.
Present online.
Thank you.
I'm also present. I'm sorry, I was having trouble unmuting.
Thank you. Division of Blind Services of the FDOE, Cesar Vigo.
Present online.
Thank you. Economic Council of Palm Beach County, Craig McKenzie. El Sol Jupiter, Suzanne Whitbeck. Florida Hispanic American Chamber of Commerce, Juan Pagan. Florida Hispanic American Chamber of Commerce, Evelyn Vargas. For the Children, Reggie Derndies.
Present online.
Thank you. Gold Coast Down Syndrome, Sue Davis Killian. Thank you. Guatemalan Maya Center, Mariana Blanco.
Present online.
Oh, great, thank you. Hispanic Chamber of Commerce, Maria Antunia. Hispanic Education Coalition of Palm Beach County, Hector Pedra. NAACP South Palm Beach County Branch, Diedrich Strawn. Palm Beach County Council of PTAs, Charmaine Postal.
Good morning, present online.
Thank you. Palm Beach County Council of PTAs, Marcus Brown.
Good morning, present online.
Thank you. Palm Beach County Human Rights Council, Emmy Kinney.
Present. Good morning, everybody.
Mm-hmm. Tri-City Education Committee, Eddie Rhodes. Tri-City Education Committee, Mary Evans. Urban League of Palm Beach County, Terrence Reed.
Present online.
Yes. Volunteer Association of America, Widleen Pierre.
Hi, present online.
Great. And Volunteer Association of America, Carlene Paul.
Not at this time. She's not available.
Thank you. And Classroom Teachers Association, Gordon Longhofer.
Present online.
All right. And Palm Beach County School Administrators Association, Jay Blavitt.
We're gonna have to get another representation from you. And then there's a phone number.
I don't know.
Is that you? This phone number, 04? No. We're just trying to figure out who's on at the meeting with the last two digits of their phone number being 04.
Is that Charmaine?
No, Charmaine's name is on there.
Okay.
Hello?
It could be Dr. Corbin Thaddeus.
Okay, thank you.
Okay, I have her check. So we have 14. We have 14.
Call for approval of the May minutes. Will I? motion for approval?
This is Reggie. I move to approve the May minutes.
Thank you. Second?
I second.
Approved and second. We continue. Now we go to the public comments. I don't think we have anybody on public comment so far. So we will continue. We're going to go for the update of the DDEC ad hoc subcommittee, the subcommittee representative. Who's going to be the first one?
I will be the one to say that we did not meet this month, and we will only meet in the future when we have a call to action. If Keith is available to lead us on additional work on the directives regarding high academically achieving Black male students, then we will move forward, but otherwise we will not be calling meetings.
Thank you. And you were the only one scheduled to present, correct?
On that issue, yes.
Thank you. On the next one, and according to the agenda, we have Mr. Keith Oswald. Unfortunately, he will not be able to be with us today. His father just passed away. Very sad. He was ill, and our deepest condolences to him and his family. You know, I wish him the best. He was over 85, 86, something like that. You know, already. And he was sick, and unfortunately, well, it was his turn, and the Lord called him. Our blessing to him and his family. Thank you. So we don't have anybody who's going to do the update for Keith?
No, there's no update.
There's no updates, okay. So we go to new business. So we go with the District ESE Advisory Committee. Kimberly, Aspire?
Yes. I promised last time that I would get the report or presentation from Kevin McCormick, and I was unable to do so once again. May we be scheduled for the fall, because I will definitely be able to get something from him by then. And my apologies, but there's something they need to do.
All right, well, thank you, Kimberly. We go to the next item, it's the Welcome Center. So we'd like to invite Julie Acevedo.
Okay, tell me.
Julie, are you present?
I don't have it. Julie, can you share it with me? Did you share it with me?
I started with, hello, everyone. 1 second.
With Jonathan. I should have had you share it with me also. You shared it with me? Okay. No, did you share it with me? No. Oh, I thought, yeah, okay. Jonathan, can you share it with me? 1 second, you guys. Yes? Okay. Go ahead. Oh, you got a request?
Yeah, from him, I just.
Oh, she got a request. There it is. Okay.
Please.
Yes.
I can start talking. Hello, everyone. My name is Julie Acevedo, and for the past year, I have been overseeing the district's Welcome Center. Surprising enough, within this year, I found that a lot of schools and community agencies were not aware of who we are and what we do. Thank you. And so I am privileged to be sitting here this morning in order to introduce a little bit of what the Welcome Center is for Palm Beach County schools. Just a little bit about us. The Welcome Center has a little video that we've posted. It's on our page, but just in case, I want to share it with you. I'm not sure if I can do that. I think whoever has the slides can do that. Sorry. Can you just click the link where it says who we are?
Oh, I thought she had
The Welcome Center, Palm Beach County Schools, welcomes families from all over the world into our district. Our main purpose is to help you transition and facilitate the registration process to be a smooth and easy transition.
I'm here today because I wanted to get my son vaccinated, to do his immunization, as well as to do a physical so he can go to school.
There are 4 major things that Welcome Center does to support families as they transition into our Palm Beach County schools. Number 1, appropriate grade level placement and advising students on recommended course selections. We also do an evaluation of school transcripts. We offer interpretations in 4 major languages: Portuguese, Spanish, Haitian Creole, and Mayan languages. And the last one that's so important is immunizations. Palm Beach County Schools has a partnership with the health department to facilitate vaccines to newcomers and also transfer shots received into the Florida forms.
And it's just very good that they have a center like this where people from all over the world can come and get the services that they need done.
So if you are new to our county, please come visit us as we welcome you and help you transition into one of our Palm Beach County schools. So in a nutshell, that's pretty much what we do at the Welcome Center. The Welcome Center is designed to help families that are coming from all over the world register into our county. Oh, 1 second. Okay, great. Register into our county schools. And these can be students coming from Broward County next door to France and Europe. Any countries of the world, we help expedite the process. A lot of families, and this is just from a personal experience, a lot of families come into Florida from all over the world, don't know necessarily the processes that are needed. When I came 10 years ago with 3 children from Connecticut, I didn't know that there was such a thing as Florida form. I kept saying, well, their shots are up to date. What are you talking about, Florida form? So we help facilitate that. And with that, we have an amazing staff that we work with at the Welcome Center. And so if you see on this slide, as mentioned in the video, we do registration, grade placement, counseling, social services, referrals, immunization, bilingual staff available, and referral to many local agencies. We work with amazing people, and I know that some of these agencies are represented here today. We work with amazing community partners that help us facilitate the transition into the schools easier. Our staff consists of social facilitators, interpreters, school counselors, and a data processor. And all of this comes together, all of these team members come together to be able to facilitate, again, an easier transition into our schools. Sometimes parents go to schools and it's hard for them to bring all the paperwork or come back. And so what we try to do with our data processor is do a one-stop shop. This year, we've had the amazing blessing and opportunity to work with Found Care. So our families not only are getting the immunizations the day that they come in for the Florida shots, but they're also getting an on-the-spot or on-the-same-day physical. So the students truly leave our Welcome Center fully, completely ready to start school that same day or the very next day. These are some of the agencies, as I mentioned, that we work with. I'm updating this, so some of the agencies you might see there, this is on our website, but they're not up to date. This year, we've received brand new agencies that we're also working with, and we will be updating this guide as well. Here we go with Found Care, which is one of our agencies, partner agencies for the physical. And these are our flyers. These are our dates for our immunizations and physicals for June and July. If you are on the screen and you want to take a picture of these dates, you can find also these flyers in the district webpage. But if you want to take a picture and share it with your families, we are here on those dates for the month of June and July. I'm sorry. Yeah, this is at the Welcome Center, Building E. Yes, Building E turns into, on Wednesdays, a walk-in clinic. Interesting enough, right? Yes. Okay, so just a quick glance of what school year 24 looked like to us. We opened up the year with our very first ever back to school event. This event was amazing. A lot of our agencies came out to support our families. We donated over 300 backpacks. We had free haircuts. We gave out 200 uniforms. We did 60 vaccines, and overall we serviced about 575 families that day. It was an amazing event, and I keep using the word amazing because it's just a great word to use because we helped so many families that day. Families, every child walked away with a gift, a toy. We raffled bikes. The library did card registrations. We opened up the year with this event, and it was very well received. If anyone was here around that date, you would have seen a line of people wrapped around the entire E building. It was just phenomenal. Well, this year we have our second, and the flyers are already ready. Everything's ready. We have our second annual back to school. We have gotten such an overwhelming response from our community that we have been able to secure over 500 backpacks. And so we are expecting July 18th, we're preparing for over 500 students, which means that if each student brings a mom and a dad, there will be close to 1,000 people, if not more, that day. It will be in the back. We're going to take over. Just get prepared. District staff, we're going to take over the back parking lot of Building E. We will close all of that area. It will be an outdoor event. We have over 20 vendors that have confirmed their attendance. We're even going to have Kona Ice for the children here with us. So there'll be backpack distribution, school supply distribution, free haircuts. We're going to have for the very first time glucose and blood pressure screening for parents. So it's going to be very interesting, a lot of fun. I invite all of you, if you're in the area, come around. We'd love to see you. We have started a registration process or welcome center / immunization / everything that's happening here out in the Glades. So we have started a Glades registration and welcome center out there as well to have those families also participate with the facilitation of registering into school even at the Glades. It's been a great year. As I don't know if you guys know, but we have a new registration process that's opening up for everyone K through 12, which is online enrollment. And we're also working with families to help through that process. We have a video to explain how that enrollment is going to happen, and so we can better support the families. The video is not updated yet, but we're working with FTE to have all that updated information for our families. Remember, the Welcome Center is here to support families, again, from all over the world in all different languages. Obviously, we don't speak all the languages, but we have the language line, and we also have our interpreters to work with our families. What we want to do is make sure that every person that comes in to Palm Beach County Schools to register have seamless experience, and they can be able to enroll with minimal issues, and they have a wonderful experience as they're registering into our amazing district. Here's my contact information. If you have any questions, we would love to talk to you, and we would like to support you in any which way we can. Thank you for the time.
Thank you. Any questions for Ms. Acevedo? Is there a question in the box?
Oh, no. Are there religious exemptions for immunizations? If so, what form needs to be completed?
Well, thank you so much for that question. Yes, there is religious exemptions. We work closely with the health department to give out that information. There is a form number that you use. I can't remember on the top of my head, but if you send me an email, I can send you it's actually not a form number, it's an email that you use with the health department, and you send them your request, and they'll immediately, within 48 hours, send you the religious exemption.
And is it Julie.Acevedo?
It's Julie.Acevedo at Palm Beach Schools. Excellent, yes.
Excellent. Any other question? Thank you very much, Ms. Acevedo. Moving to the next topic, well, it's going to be the FLDOE General Relationship Education Survey. Keith is not here, so she will be doing that. All right. Go forward.
I'll just be doing it all. All right, let's go to this one. Too much going on. Thank you, Julie. Appreciate you. All right. Good morning, everyone. I'm just going to go through, this is all from Florida DOE. These are not local resorts. These are state results. I'm thinking about a resort. These are
Yeah, right. We all.
I'm ready to get out of here. These are state results, and it's about the Florida Specific Youth Survey. There are two parts to that. It's a resilience survey as well as a health survey. And I'm going to just briefly go through some of what Florida DOE has put out. And as you see, it's from 2022 to 2023. That's the sample of the students for this particular survey. And I also will be sharing, Susan will be sharing this information with you sometime today. She'll send it out in an email. How do you make it full screen? So I can make it full screen in here, yeah. All right. So the resilience score, the general resilience score is 3.74, and there are different characteristics of that. It's citizen. Oh, okay. Let me close this one out. Okay. Now I'm on the meeting? Yes. Okay, I'm sorry, I had it open twice. And there are different characteristics that go into the resilience score: citizenship, critical thinking, empathy, gratitude, grit, honesty, mentorship, perseverance, problem solving, responsibility, responsible decision making, self-awareness, and self-management. According to this, the general resilience score for the subgroup comparisons, so they have subgroups of Hispanic, white, African American, black, Asian, American Indian / Alaskan Native, Native Hawaiian, or other Pacific Islander and multiracial students. And the sample was of 9th, 10th, 11th, and 12th grade students. And they also break it down by male and female. So here, the general resilience is considered high, and it's considered high in those subgroups, except the subgroup of American Indian or Alaskan Native. It's considered medium. And that's just based on a Likert scale. That's how they were able to rate each of the characteristics. Yes, ma'am.
So it looks like almost all the subgroups are higher than the overall.
Yes.
Oh,
Then,
thank you. It looks like almost all the subgroups are higher than the overall. The overall was what?
374.
So Hispanic. So like Hispanic, for example, it says 3.72 and it says high, but that's lower than the overall. So this
Correct.
is This is, the high is not in relationship to overall or to any other group, it's just its own scale.
So so the high is the overall of the entire population of the sample.
No, I'm talking about where it says like Hispanic 3.72 and it says
Yes.
high.
Because 374 is a high score, but so is 3.72. That's considered a
That's-
high
okay,
score.
that's what I'm- So, all right,
So when the Hispanic subgroup did their general resilience score and they used the data to average it out, it came up to 3.72. But when they put all those scores together and decide what and average those out, it comes to 3.74 for the entire population. Does that make sense?
thank you.
Okay. Somebody had a question in the box. Oh, go ahead, Dr. Ferguson. I mean, Mr. Ferguson. Mr. Ferguson, did you have a question? Mr. Ferguson, did you have a question? Okay. I'm going to go ahead and move through this. So citizenship, here we go. This is another resiliency characteristic. And on this one, it was a medium score of 3.01. And then there was no score at all for Native, Hawaiian, or other Pacific Islander. The sample was less than 10 respondents for all characteristics except grit. So this is why there's a star there. And as you can see, Hispanic fell below, African American, Black fell below the entire population, American Indian, Alaskan Native, as well as the multiracial students. Critical thinking scored high for the entire population, and the Hispanic population was lower, but still considered high. Someone else raised their hand. Did you raise it? Mr. Ferguson, did you want it?
Yeah.
Okay.
I had to use it, log in with a different phone.
Okay.
I'm sorry, what's the purpose of this survey again?
This is the Florida Specific Youth Survey. So, we have to do the youth mental health training for our staff. So it has to do with, I'll tell you exactly where we are. Where's my Canva? So let's go back up here. I'll tell you exactly what it is. So it has to do with Florida Statute 1.03.42, including resiliency education. It has to do with what's going on in Tallahassee, basically. So it has to do with the instruction for health education, and as well as resiliency education, civic and character education, and life skills education. So we wanted to share the results with the committee.
Is Florida Statute 1034.42, or did I?
No,
close the number?
1003.42.
Oh, okay, 1003. Yeah, I know that one.
Right. And so the data was collected from a sample of high school students during spring of 2022 to 2023 to drive the training, the youth mental health training.
And the different, I heard you say grit. There were a few other ones. I'm driving, so I wasn't able to really look closely at the survey. Can you just run those by me again, please?
So there's a general resilience score, and what goes into that is citizenship, critical thinking, empathy, gratitude, grit, honesty, mentorship, perseverance, problem solving, responsibility, responsible decision making, self-awareness, and self-management. And according to the data results, citizenship and mentorship fell in medium, and all the other characteristics fell in high when it came to the student survey.
Okay, students.
So I was just briefly going through each of the characteristics of the Florida Specific Youth Survey, just so. But we're going to send this out to the department. The committee.
Okay. Thank you. I appreciate it.
Not a problem. All right, so critical thinking, as you can see, scored high, except when it came to American Indian or Alaskan Native students. And again, our Native Hawaiian or other Pacific Islander students, less than 10 in the sample, so they do not use that data. And then here we go with empathy, scored high. Again, our Native Hawaiian, Pacific Islander students did not have enough students in the sample. Gratitude scored really high, 4.23 high, and it scored 4 in the 4s, except in our American Indian or Alaskan Native American students. And again, high here. And as we can see, there's kind of a when our Alaskan, American Indian, Alaskan Native students, it seems that they're scoring lower across the board. So we're really interested to see what happens when we get the data for our district. Here in mentorship, it scored medium, and that was across the board. So I believe that our trusted adult initiative that we have in Palm Beach County may help with our local results for mentorship. And then perseverance, high. And again, our American Indian or Alaska Native students were scored at medium. They scored at medium. Here we have problem solving. We scored high. And then our African American, Black students, and our American Indian or Alaska Native students and multiracial students scored medium when it came to problem solving. And this is where, and you got to realize that they are talking about their own characteristics within themselves. So they're not rating schools. What is that? Okay. Let me just go through this particular, just briefly go through this, and then we can ask questions. Responsible decision making, whether they think they have responsible decision making. And here we are again with our American Indian or Alaskan Native students, medium. Self-awareness, high. And again, here is where the discrepancy is. Self-management, we scored high Florida scored high 3.52, where our Hispanic students, American Indian or Alaskan Native students, and multiracial students scored themselves in a medium on that. So those are our resiliency. That's our resiliency survey for the state. Okay, so questions. Can you help me with that? Michelle?
Yeah, hi. I was wondering how the sample size of this new survey can be compared to the sample size of the former youth behavior risk survey, because I wasn't sure if the state was distributing this assessment in a similar comparative way, or if this is completely separate from the way that the former assessment was administered and utilized. As far as is this a relative or prospective assessment for our kids?
I'm sorry. So as far as I know, this survey is. Repeat the first part of the question.
Was this new survey administered as far as that sample size in the same way that the youth behavior risk survey was administered?
And I'm not sure about that.
Okay, because there does seem to be some discrepancies with the self-rating versus the comprehensive data that was shared in the last meeting. So I'm trying to piece it all together.
Right. So I'm not sure if it was administered the same way. That's a question that I'd have to probably ask Mary Claire. Mary Claire sent the results to us, and so I'll have to ask her that. But I'll ask her that, and I'll get back with you. Will you email me that question?
Sure.
Thank you. Dr. Cassandra. Dr. Cassandra.
So thank you for sharing this, and I especially appreciated seeing some social and emotional wellness pieces in here.
Yes.
My question is, this is almost 2 years old now, and I'm curious how and if there is some thought or planning about how then to take this. I know that you mentioned this was going to inform the training for the adults around the mental health pieces. And I'm also wondering if there are other like key learnings from this survey that we could actually pull and use and inform like the environments in which our students are in. I'm just curious like how we're thinking about the survey result and using it more holistically.
So the purpose to share this with you is so that you could pull the information to also assist in how your community efforts, right? The survey it is from 2002, 2023. It's because they were rewriting the health education standards for the state. How we are to required instruction for health education, as well as resiliency education, civic and character education, and life skills education. Because we no longer say social emotional. They took that out of the Florida statutes. It's now life skills. So this survey was used to drive the instruction for that, as well as the youth mental health training for adults. But we wanted to share this with you for the community efforts, because I think that it is important to notice when students are rating themselves, when they're rating themselves low, especially certain subgroups. Did I answer your question?
Yeah, I think so. I just want to process it a little bit more. So,
Okay.
but I do appreciate the response. Thank you.
Okay. Any other questions?
Yes.
Yes.
On the citizenship, which is low, and it would seem to be one that schools would have a fair responsibility for. Is there? What is the analysis for that? For that, and then I have a second question after that.
So we have not received local or any results for this specific survey for the school district. This is state information. So it was used to drive the instruction for health education. So I'm pretty sure that they have used this to make sure the standards for health education address citizenship.
Okay.
Next.
And then the full report does it break out for ESE, for example?
It did not. It did not break out for ESE, ELL, or socio-economic, low economic students. It did not. Title I kids.
Okay. Thank you.
Ms. Kinney?
I was just wondering if you all at the district saw the actual survey questions that were on the survey, or if do we have access to that, the actual questions that they were asked?
That's a question I'll have to ask Mary Claire, but I'm not. I was not given the questions, just the data from the results.
If we can request I too am like wondering how this compares to the youth risk behavioral survey. It seems to me like this is their replacement for that to eliminate all the LGBTQ questions and social emotional learning and all of those things that they want to remove. So I'm just wondering if we can, I feel like this has no information for my group at all. It doesn't, but just to see the questions that they're asking, it's hard to get any kind of usable information from this survey without knowing what the questions are.
Right.
I really have no idea how they're asking questions like about empathy to like score empathy and
So
things like that.
it's on a Likert scale, so they're scoring themselves as to 1 equals never and 5 to almost always. So it's, yeah.
Right.
And I'm not
But
sure what the questions
what are they being
were.
asked? Yeah.
No idea. But I will ask Mary Claire if we can get those questions, if it's possible.
Okay, thank you.
And Dr. Cassandra, did you raise your hand again?
No, I was just saying that's a great question.
Oh, okay.
I'd like that too.
Kimberly?
Yes, I know that they didn't, some of the groups that I think we would want to get results from and see where we, as people who care and as the educators can help our disability. And I know there's no way to really do LGBTQ because we can't keep track of those numbers, understandably, but it seems like, and also the socioeconomic, those are the kids that will probably come up with the answers that give us more of a job to do. These are the kids who are probably struggling in these areas more than particular like racial demographic groups or the intersectionality of the racial groups with these particular factors. So as an end user of this survey, is there any way the district for ability to be for them to break out? And also, I don't know, I guess kids, it would be hard to ask them the economic questions, but as a representative of people with disabilities, I think the answers for a lot of these questions would be concerning for kids with disabilities.
Kimberly, was there a question in that?
Yes, the question is, could the
okay.
district put a request in that in the future, the disability numbers and answers are provided to you?
Okay. You wrote that down? Yeah. Okay. Okay. Yes, ma'am. I'm gonna request that, and I'll ask Dr. Mucinek about that.
Thank you.
Anyone else? All right. We're gonna briefly go over the health behavior section of that particular survey. And the 10 domains there were injury prevention and safety, internet safety, nutrition, personal health, prevention and control of disease, substance use and abuse, child trafficking prevention education, teen dating violence and abuse, sexual abstinence, and resiliency education, which we've already gone over resiliency. So injury prevention and safety, 88% of students can recognize signs of cyberbullying. 16% of those students and these are just the sample students to drive the health education initiative. 16% of those students reported being bullying, and 12% of those students reported being cyberbullied. Injury and prevention: 61% of students always wear a seatbelt. Right, that's all. That's what Susan said, that's all. Let's see. 40% in the last 30 days of that survey reported texting while driving, and 11% of those students reported drinking while driving.
Yikes.
Okay. Internet safety, 79% of students spend 3 or more hours on an average school day engaging in screen time. 91% of students are aware of the risks of meeting with someone in person that they have met online. 89% of students can report unwanted messages from unknown senders. %43% of students never respond to messages from unknown senders. Nutrition. During the last 7 days before the survey, only 23% of students almost always consumed a healthy food. 42% of students ate breakfast for 5 or more days. Personal health: 67% of students visited a dentist during the past 12 months. 59% were physically active 4 more days, and 21% of students engaged in 8 or more hours of sleep on an average school night. So we know our students, they stay up late.
Question, what was the age of the students?
9th, 10th, and 11th, 12th. 9th, 10th, 11th, 12th graders. So that can range anywhere from 13 to 19 years old.
Okay.
The percentage of students aware of the signs and symptoms of the following diseases: obesity, 79%, 62% for lung disease, 60% for heart disease, and 69% for STIs. Substance abuse and use and abuse. The percentage of students who have ever consumed the following substances: 37% alcohol, 7% cigarettes, 19% vaping, 17% marijuana, 8% unprescribed medication. And 79% of the students are aware of the supports and resources available to them if they had a problem with substance abuse. Child trafficking, 62% of the students can recognize the signs of human trafficking. 76% of students can report the signs of human trafficking, which means they know who to report it to. Teen dating violence, 9% of the students have been a victim of teen dating violence. 76% recognize teen dating violence and abuse, and 75% know who to report it to. Sexual abstinence, 26% of students have engaged in sexual intercourse. 69% of students are aware of the benefits of abstinence from sexual activity, and 91% of the students are aware of the consequences of teen pregnancy.
Could you go up one? What
Yes,
was the
ma'am.
one?
I'm going back up.
Go up one? Okay,
This one?
all right. Okay, thank you.
Okay. And this is the resiliency education, of course, during the current year. 22% of students almost always felt the symptoms of stress, anxiety, or depression. 46% had feelings of sadness, hopelessness, loneliness, nervousness, worry, or being afraid that stopped them from doing some usual activities. 19% seriously considered harming themselves. 31% sought out resources when they had a mental health challenge. 77% of students have a trusted adult in their life, and 78% of students are aware of resources if they had a mental health challenge or concern. And that is it for the health survey, the health section of the survey. Are there any questions? Okay, who's that? Hi, Dr. Robinson.
Hey, good morning. Sorry I'm late. Is
okay.
any of this data disaggregated at all? Like, can we tell girls have more depression than boys or anything like that?
This is how it was sent from Florida Department of Education. The resiliency strand is disaggregated by the characteristics. We went over that prior to you coming to the meeting, but the health strands are not.
Okay, thank you.
Somebody else got a hand up? Michelle?
Yeah, I think just the same questions about what the survey questions that were asked of the kids really were, and if this was proportionate for us, like the size of whether it's a large district, the small districts, and whether it's truly representative of our population. Because some of these numbers, there's some discrepancies between some of the community data around youth mental health and engagement in the highest levels of care, as well as with Baker Act reports from USF. So I do think that that analytical part of this is really going to be important if we can get that from DOE, which I know is a tall order. But to get that disaggregated data to see how this relates specifically to Palm Beach is going to be really important.
Got you. You wrote that down, Susan? Write it down, please. That she wants the, we want to try to get the questions and to see, and the disaggregated data and where the sample students come from. Is it from a large district? Is it from different districts all over? And I would just, and my question is, are they really answering those questions honestly? Because some of the data seems a little skewed to me also. Yes?
And to Kimberly Claro's point also, if we were able to disaggregate the ESE component or supports, what is the comprehension of questions that are actually being asked of the students if it's at their expected levels for understanding and answering.
Okay. Emmy?
I don't have a question. I just feel like it's hard to come to these meetings every month and watch the erasure of LGBTQ students happening before our eyes and see what is happening politically, really affecting our kids. And the 16% number for kids getting bullied, it just shows me how generalized and vague this data is, because we know from the risk behavioral survey that for LGBTQ kids, that number is 40%. So I don't have a question. I just want to insert this feedback. If there is any advocacy happening at the district level for towards the Department of Education, I know, it's a tall order, and I don't think anything will come of it under the state government we have right now. But I just feel like I need to say that to this group, that it's very difficult for me to watch the erasure of LGBTQ kids happening before our eyes. And this is just yet another example.
I'd like to comment that we have our chance to give them some feedback in November. So
Yes.
when it's time to vote. So.
Yes. Any other questions? Any other statements? Any other comments?
Janina, I put a question in the chat. I just wanted to be reminded of what the two from the very beginning, you said that were medium, I guess, noted, and it was mentoring and something else. And I just wanted, if you can remind me what that one was.
We're gonna send all the survey information to you. Let me see, I have to go back to it. It was mentorship and citizenship.
Citizenship, thank you.
Yes, ma'am. Okay.
Thank you very much. Any other question? Any other comment? We moving along. The next item in the agenda is the fiscal year 2025, the meeting schedule. A few probably get a copy of this. For 2024, the next one is, there's no meetings in July, no meeting in July.
I'm share it for you.
Okay, they're gonna share, so August 22nd, September 26th, October 24th, November 21st for 2024. In December, there's no meeting. Then we jump after the Three Kings. Remember, it comes on January the 6th. It will be, Fiesta del Pueblo will be on January 23rd, February 27th, March 20, April 23rd, and then jump to May 15, and then to June 12th, 2025. So we're looking forward, make sure all of you staying alive. We would like to have you.
Just, April 23rd is a Wednesday. We won't be here on Thursday, just like this year. It's Take Your Child to Work Day. So we'll be here Wednesday. And we did June 12th, it's a second Thursday, early, so we don't have this conflict next year.
Conflict with Juneteenth.
Yeah. All right. Because we'll be off that day.
All right.
Celebrating.
And then the next item in the agenda is unfinished business, the HAABMS recommendation to the board. Subcommittee representative, please.
She said we didn't have anything.
We don't have anything, okay.
We're waiting for Keith.
Okay, we move along.
Oh, wait, somebody's hand is up. Go ahead.
So good morning. For the meeting dates, is this just for us to review so that we could approve at the beginning of the
No,
year?
we're supposed to vote on it.
Or will we be approving this
I
in July?
think we're supposed to vote on it.
Yes, we are. Well, I said that.
At this meeting? Because typically the committees or the members of the committees could be appointed based on their appointments to this committee, which could be year to year, if I'm not mistaken. I just want to make sure, because in the past, we have always approved this calendar at the first meeting, if I'm not mistaken, either the last meeting or the first meeting of the year. So I just want to make sure that we're approving it appropriately.
So I believe we're approving it at the last meeting of the year, which is this meeting.
Okay.
It was attached
And
to,
so if we are approving it, are we reviewing, because we were going to the next agenda item, is this the time that we are entertaining a motion on the floor?
We should. Let's do a motion.
Unless
approve
there's
that
any
agenda-
objections that
the-
they need to review the calendar in advance.
it was attached to the calendar invite,
Right.
right? Correct?
Correct. So if we're approving it at this time, and I will.
So do we
put a
need
motion on
extra,
the floor.
so Charmaine, do you think we need extra time? Do you think others need extra time to review?
I personally don't think we need extra time because this calendar is usually consistent every year with the time frame that we would normally meet. So I personally don't think we need extra time, but I would definitely ask the committee if there is no objection to move forward in approving this calendar now, seeing that this is the last meeting of the calendar year, or I'm sorry, of the school year, and the next meeting would be to approve that August 22nd meeting. Typically, we would approve the August meeting and then review it at the next meeting, but I don't see any objections for us to approve this calendar as it is. And if there is any revision that needs to come forward in August, we address those concerns at that time.
Do we have a motion?
But I would definitely put a motion on the floor to approve this calendar for FY 24-25 as is. But I would need a second. I would put a motion. I don't know if the hand is going to supersede my motion.
Sorry, she's sorry.
Second.
We have a second, we have a motion, we have a second. The motion came from Charmaine,
Yes.
and the second came from
Dr. Robinson.
Dr. Robinson. Thank you.
And I just have a question. May I?
Question, please.
Yeah, just a quick question. You may have said this and I apologize. What's the number in paren after the dates? What's that number mean?
It's the Thursday, whatever the Thursday is, fourth Thursday, third Thursday, fourth Thursday, third Thursday, fourth Wednesday, third Thursday, second Thursday
Dr. Cass, it's the week that that Thursday fall on,
of the month.
of the month.
Okay, all right. Can we maybe note that somewhere on that calendar, just if somebody's looking at it, they know what that means? Does it say somewhere? I don't see an asterisk anywhere.
No, Susan will change it.
Yeah, makes sense.
Thank you.
Thank you. Any other comment, question? So the agenda, proposed agenda is approved.
A motion, the motion wasn't completed. We just had a motion on the floor with a second, and we were at a discussion with a question on the floor.
Okay.
We need a vote.
So we have a vote. All in favor?
Aye.
Aye.
Aye? Yeah?
Aye.
Anyone opposed? We move forward, the motion passes. Thank you. Okay. Well, and if we look at the agenda, our fiscal year meeting is adjourned. Wish you all a great summer, stay dry, and use suntan lotion, because it will help you. It's going to be hot. Thank you, guys. We appreciate it.
Thank you. Bye-bye.